right now we're kind of caught up in a narrative cycle where people are, shall I say, many people are treating COVID as an inevitability, have kind of given up and lost all confidence in the ability for the government to respond meaningfully based on what it's done over the last 2 years. And I wonder, with the perspective of how COVID has been addressed in other countries, what you make of that kind of public apathy.
Of course, it's really sad. It didn't have to be this way. I had hoped, and I still hope, that there will be lessons that have been learned out of these experiences that can create better forms of living. But it's really disappointing to see that the huge structural opportunities that this virus presented to us have not in any way been made permanent or even semi-flexible, that a lot of them have been abandoned. And there were certain things that I hoped, culturally would take off and still could over time that aren't particularly expensive. For instance, in many countries in Asia, since the first SARS outbreak in 2002, 2003, mask wearing has become a matter of course when people are sick with anything, not just that SARS, but, and so there were really good benefits when people had, the common cold or influenza or other things certain times of the year, they would wear masks just as a part of the culture. That is not happening in the United States, and that's really sad to see. And then structurally, there are, things that there are huge things that you and I both care about, and the campaign where we first met cared about. I'd hope that because you had Joe Biden and Bernie Sanders and other Democrats running, that someone like Sanders and or the platform of getting healthcare to everybody, if there were a moment for this to have taken off, that should have been when it was. And I mean, as we know, like most people in the country want that, but the political class doesn't allow for it. But I'd hope that that something like that could have happened out of this, and it's really disappointing to see that it didn't. South Korea continues to be one of the countries in the world, despite the many criticisms the movie Parasite has of it and that I write about. But it actually is one of the countries in the world where people have been the happiest with the government. And it's had a mixture, they don't have formal mandates in the ways that we always apply them, but they continuously seem to have a trust in the public health agencies. They also have some version of universal health care, so they're not going off the cliff financially when they get sick. And the public health agencies in that country have continuously communicated about what they know and what they don't know to the public, and have said something along the lines of continuously, conditions may change, stay tuned. And in this country, we've had a really hard time with people, understandably, being confused by our public health systems, who have not accurately said at times, this is what we need to know now. When we know more information, we will let you know. And a lot of that distrust, from the public is understandable because they're not getting that kind of messaging, and they're getting very conflicting things from different levels of government.
Yeah, well, to that point, I think there's a lot of public health officials at this time, the last week or so, who have come out and said, we oversold the extent to which the vaccines were going to prevent transmission, and that was a mistake.
I knew these vaccines were not going to protect against infection, and I think we overplayed the vaccines, and it made people then worry that it's not going to protect against severe disease and hospitalization. It will, but let's be very clear. 50% of the people who died from the Omicron surge were older.
And sure, that is the most recent mistake, but there do seem to have been a number of moments like that where either there was a accidental or intentional misrepresentation about the efficacy of, let's say, cloth masks or the flimsy paper surgical masks as compared to the KN95 or N95 masks, which are much more effective. And then that accompanied, those kind of moments of advocating for interventions that aren't especially effective, on top of a lot of kind of moralizing attached to those interventions, have made the interventions that really are effective, like masking with high quality masks, kind of dismissed in whole cloth, along with the stuff that didn't really work. And I wonder what you make now in kind of retrospect of the way the public health messaging has gone. And, what would you do if you could right the ship? If you were in the Fauci spot, what's starting from this place that we're in now, where there's like so little public trust, would you recommend?
It's really hard. I mean, one of the things I think we just have to be honest about is that you can't undo history. It takes time. And so there are reasons why people are distrustful of the public health infrastructures. An analogy I often think about is that if you get cancer, you're not going to get the kind of treatment that some people got for COVID because it's not transmissible in the same way. And so there isn't like a trust that when you're asked to do something for the good of the society, excuse me, hope you can edit that out. So there isn't a lot of trust when, if people come to the government, go to the healthcare provider and find out they have something like cancer and they're told you're on your own to deal with it, then when they're asked to do something for the public good, they're understandably not as willing to make a sacrifice. And one of the biggest problems that I think we've seen that is almost an administrative problem, but it's substantial, is that with our for-profit health system, people are endlessly getting secretly billed for things.
Mhm.
And you are asked with many COVID things to provide insurance information, even if you weren't getting billed for it, although some people were inaccurately getting billed for it. It was supposed to get billed back to the insurers, but like it scares people away because if you've ever had the experience of going to a hospital and getting an anesthesiologist bill when you thought the hospital and the doctor were in your network, that creates a lot of distrust. And there have been endless things like this that have created more distrust, including now the government is not paying for people without insurance before, except some jurisdictions like New York City, or I think in San Francisco, certain municipalities are still doing that. But like, if you don't know that, you're not going, or you're afraid to go, that thinking I'm going to go and get a $10,000 bill or a $100,000 bill. I think the biggest things I would have tried to do differently in the beginning. Obviously, it would take a magic wand to make Medicare for all come into place, but to have really substantially, in the beginning, been very proactive about stopping transmission and making stopping transmission an ongoing effort. And I think that we didn't know like how effective the vaccines were going to be. We had pretty good data, and that data has held up relatively well throughout the time. Throughout the 2 years or so, these vaccines have been in circulation, that they do stop a great deal of serious illness and death. And that, of course, has been a lifesaver for millions, tens of millions of people around the globe. What we didn't know at the time, because we are all essentially in a long-term study together, and this is the reason that we're even able to get the vaccines at this stage, is a holdover by work that activists during ACT UP in the early days of the AIDS epidemic did to speed up this process. So, we know the vaccines aren't going to hurt us. We know they're going to stop death. How long they're going to be effective for, that's an ongoing experiment. And so it was a mistake to oversell them. At a tactical level, the biggest mistake there was to look at the way the United States pretty significantly, it was with a lot of spit and tape and prayer volunteers, but pretty spectacularly got up to vaccinating 4 million people a day, which is unheard of. And I wish that the United States had taken that moment, if not to create Medicare for all, to at least said, we have a distribution system in place. I think actually a lot of people who are doing volunteer work like that would much rather be doing this kind of work than the bullshit work that they often have to do. And and they like helping their neighbor. How do we figure a way that if not 4 million, maybe 2 million, maybe 3 million shots we could give a day? And if we had built up some kind of infrastructure around that, you would go get your booster 2 or 3 times a year through that process. You would go get your flu shot once a year through that process. Something comes up like monkeypox or meningitis or any number of other things around the country that are local. You have an infrastructure to get the vaccines out to those people. And so we're back to this place that's really damning and frustrating with the early days of monkeypox being, this wave of monkeypox being in the United States, where all that infrastructure is gone. Fortunately, the cities where it's most happening have functioning infrastructure around this. They just haven't gotten the stock of vaccine that they need from the federal government. But if they could get it, New York, Chicago, San Francisco, these places would get the vaccine out to people, but they're not getting it. And I don't think we're doing surveillance in, wide swaths of the country where it could start to be moving and there's no apparatus for it. But that would be if I could do one technical thing that we had learned in the pandemic, was to have held on to that infrastructure, to accept and acknowledge and be grateful for the fact that people will show up. If you need them to do something, same as happens in other parts of the world, if people have a way to get vaccinated, have a way to get healthcare, they're going to do it. They're not always making these ridiculous choices that neoliberal clowns like to say they are, choosing, bad health. Like, they're ready to do it. And we had the infrastructure. We did it. We did it for, 100 days.
I mean, that's what is so frustrating and kind of terrifying looking at this monkeypox outbreak now, is that you see that people are ready to be very responsible in response. You see long lines of people around the block clamoring for a monkeypox vaccine. And at the same time, it's really weird to watch a group, a group that is predominantly being affected, gay men, acting in such a responsible way. And then to still have this media cycle dancing between attributing blame and kind of further trying to stigmatize a group for having recreational sex, and not really being really sure about how to handle the fact that they're showing long lines of people doing the responsible thing and waiting for a vaccine. The onus is on the government for having known this crisis was coming down the pike and not ordering the doses they needed to actually meet the population's need. And then having this weird, frantic kind of media spin where people in good faith who want to talk about how a population is being disproportionately affected, not knowing if they're actually contributing to stigma by doing so. I mean, as someone who is a journalist, how do you cover something like a virus that's disproportionately affecting a population, but of course is affecting people more broadly, wanting to warn a population, but not wanting to further stigmatize them?
Yeah, thanks. That's a great way to ask the question. I actually have to say the vast majority of the coverage has been pretty good.
Mm-hmm.
I do think certain quarters of media and certainly health reporters have learned a lot in the past couple of years. I think that the COVID pandemic made a much wider circle of people read about the AIDS pandemic, which has informed some of their coverage. The volume of it was not where it should have been for the first couple of months, but it's getting there. But this is something I think about a lot, and I feel pretty strongly, even though there are people of good faith who might disagree with me, but I feel pretty strongly actually that we have to talk about this, or I'm choosing to talk about it, as a sexually transmitted infection that's primarily affecting men who have sex with men. Now, there are other forms of, hold on just a second. Excuse me. So I think that we should talk about it as a sexually transmitted infection. Now, like all STIs, that's not the only way that it transmits. And I was actually surprised when I was seeing, some gay people I know not wanting to talk about it as an STI because they thought it had too much stigma. But I started looking up, the viruses and the other pathogens, bacteria that are categorized as STIs, and almost none of them are strictly move sexually. The ones that I've studied the most, HIV in particular, has a very sexual valence. It's moved largely what's called MSM community, men who have sex with men, which is a term that's supposed to actually not be about identity, but talk about an activity. And so not to ascribe, more things to it, because not all men who have sex with men identify as gay or bi or queer. Herpes and hepatitis B and C, all of these viruses that I've studied, like they move in all kinds of other ways, but we still talk about them as STIs because sex is a place where they transmit. And as part of a sexual health education, young people and older people need to know how to protect themselves or minimize harm in those situations. And sexual health scholars need to study them, and people who deal with sexual health policy need to incorporate them into their work. So I'm not scared of describing them sexually, and I don't think that takes away the other ways that they're moving.
Well, go ahead.
Sure, yeah. So I just, the other thing I was going to say is monkeypox has had decades of transmission that have happened in about 10, 12 countries in Western Central Africa, where it's primarily moved from animals to humans and not moved much beyond that. One of the fears now with this outbreak is actually not as much as it going to move, because I'll explain this in a second. It's moving pretty much between a particular community. It can move outside of that, but it's not going to move as quickly. But if it goes from humans to rats, or humans to, dogs to rats, and then is amongst all the rats, then it can come back into the humans.
Wait. Well, how would that? How does that like? I kind of get humans to dogs to rats. I'm a human. I get monkeypox. I touch my dog. The dog is rooting around. Maybe I have a terrier. Okay, it gets to a rat. The human to rat transition, is this something that we should really be concerned about?
No, I mean, I'll let virologists take this on more, but I think it's more likely your pet gets it, your dog or your cat gets it, and then they could move it into a
It's
rat.
not like a pizza rat scenario. The rat takes the bite behind me on the 6th train.
No, because, and this is, I mean, there's not enough clear information about this. I know that some health departments are taking, telling people you need to get away from your pets because they don't want the pet to get it, for other dogs to get at the dog park, and so on and so forth. Because generally we know that it moves, it's moved amongst rodents quite quickly, and it's not moved as quickly as amongst humans. So it's like keeping it away from the rodents.
So this is all very interesting to me, because we had an expert on the Hill this morning, a reporter who has been covering monkeypox from the Washington Post. And he was talking about the World Health Organization guidelines that were promulgated, I think, this morning. And they were saying, don't share towels.
Yeah, so I think that it's a very hard needle to thread, but the position I'm taking is that right now we know 98 to 99% of the reported cases around the world are happening within men who have sex with men. It's coming, there's more research to be done about how much virus there is in sweat, vaginal secretions, semen, all different body parts, how it may primarily be going through touch, but the touch that's happening is primarily happening through sex. And so I'm very concerned at this time that the focus is kept on lowering transmission amongst these people, include me, because one, we're most at risk, but two, the best way to control it within the human population is to stop it where it is. So, excuse me. So I'm kind of concerned right now that people think I can get it anywhere from any service from a towel. We haven't had a lot of those cases coming so far, which is not to say that, as you should with any virus, like if you're infected or you think you might be infected, you're going to, wash your clothes in a certain way and behave around other people in a certain way. But I'm a little worried right now about people who are very, very low risk, panicking and sort of demanding access to the vaccine right now, when we're going to get a lot more bang for our buck getting it to the people who are most at risk, because if they're protected, then the broader population will be protected.
But here's the thing, Dr. Thrasher, that I'm worried about. There was the thing like this that happened early in COVID, where because they didn't want people frantically trying to go and get high quality masks that were scarce and that medical professionals needed, there was some pussyfooting around whether or not COVID was airborne and what kind of mask you should need. I think we're still dealing with the consequences of that. And I think it's a little bit of a dangerous game when you want one public health outcome, like people not rushing to get 95s or people who aren't at high risk rushing to get vaccines, but aren't super upfront with what risks are and what the real calculations are in a way that ultimately makes people feel misled. So someone like myself, I got to tell you, I was like, whatever, this isn't my issue. Like, I touch nobody. I'm not out here in the streets right now. Like, it's COVID. I go to work. I go to the Hill. I come home. I order my groceries.
That's a very good, it is COVID. So like, if you're following COVID protocols, you really don't have to worry about the system. And I've been responding to people saying, oh my gosh, I need to start wearing my mask again because of monkeypox. I'm like, no, you need to wear your mask inside because of COVID. Like, 0 people have died in the United States from monkeypox, which is not to minimize the amount of pain that it's caused a lot of people. But like 1 million plus people have died of COVID.
Right,
so
of course.
Don't panic about that. And I agree with you. Like, it's a very difficult thing to sort of put these two messages out there. I think the World Health Organization has done a pretty good blunt job of saying, this is the population that's being affected right now. This is
Dr.
where
Thrasher, the towels. I mean, what I was going to say is that I was like, this isn't my issue. I'm fine,
Right.
But I'm telling you, when I read the thing about the towels this morning, I was like, wait a minute. That's a level of casual contact that has nothing to do with something like HIV. Like, no one's getting HIV from a towel. Like, this is like a different beast. And this is making me think more of, it's not that someone like myself would then say, okay, maybe I need to pay attention and therefore let me get a vaccine. But someone like myself might say, oh, I would like a good warning if I should start really hyping up my hand sanitizer usage at all of the stations around, the city because I'm opening doors and, even COVID, I'm not getting it from touching the door. I'm getting it from touching the door and then touching my mouth, to the extent that we're still worried about transmission on services, which I know is pretty low with COVID. They've decided now anyway. But if monkeypox is different, I would rather someone just tell me, not so that I can get a vaccine, but so that I can go ahead and put some hand sanitizer on. Or maybe do my nails at home.
I don't know. And I think these, they're legitimate questions. A friend was asking me, can I go to the gym? These kinds of questions, what I think are on people's mind. From a practical standpoint, I would offer for now that when 98 or 99% of people getting it are gay men, it's like, it's because we're having sex with each other. Like that is the mode of transmission. We don't live on an island, as much as some of us, not me, because I'm not done with my vaccine cycle yet, but it's like COVID summer 2020 again, pre-vaccine. Also not out in these streets right now, but I think that, and this is difficult, I understand. But when you see that it's that much of people, that high a percent, like that's the mode of transition. As much as we might want to, all gay people don't live on one island together. Like gay people have been using towels and, and like going to work and doing these things. And we're seeing very little spillover. There've been these two infants. An infant is a scenario where you would, hold the child very closely. If somebody was like a caregiver for, like having a lot of bodily contact, that might be a situation, but it's not. And this, I understand why it's hard for people to conceive of it. When something can move at all in an airborne way, they're not the same. Like you're not going to be across the room from somebody and getting this virus the way that was totally possible with COVID. And people's hyper awareness of COVID has both good and bad things for coming into this new scenario. I think a lot of people think airborne, this must be the same thing. And that's an understandable approach, but that's not, that's actually not the risk that's happening right now. It's really coming from very close, very intimate contact for the time being. Conditions can change. But also looking at the history of this virus and how little it moved in many decades, going from animals to a very, very small group of humans and not moving onward. It's only now that it's become part of a network of people who've traveled and had sex with each other that it started to move more quickly. But I don't think that it does not have to move, and it will never move as quickly as COVID. And I don't think that people should be as scared of casual interactions as they should be very concerned in like, what can we do to get the people most at risk vaccinated?
I hear that, but I do want to know what you think. I mean, very famously and horribly, Marjorie Taylor Greene, I'm sure you saw, tweeted, if monkeypox is a sexually transmitted disease, why are kids getting it? Quote tweeting public health CDC officials, commentary about, children being affected. And, I wondered, what do you see some risk in those kind of implications being raised about grooming and all these charges that are often leveled at the LGBT community? If you narrowly define it as an STI.
Well, this does take some literacy, which I think is a good thing.
Well, Dr. Thrasher,
which
we're not literate.
I think is something we're striving for. I don't think hiding helps anything. I think if we're like pretending like, oh no, this isn't affecting this population, I don't think that helps the grooming charges at all either. I think saying straightforward, these are the ways that things move. And it's really interesting. I haven't sort of written through this and thought this through because it's so new to me yet, but it's really interesting to me to think about. Yeah, I mean, I've dealt with HIV as an STI for many years, even though there are places where I work and the resources are appropriated, responsibly to respond to this. Research I've done in Puerto Rico, research I've done in Greece, where the primary modes of transmission are actually through injection drug use. There are places in the world where it's poor medical care that's led to blood transfusions, birth and gestation. It passes on HIV in most of sub-Saharan Africa. That was kind of the major, once it sort of got into a certain population, that was sort of the major way that it moved, was parents transmitting onward to their children. And yeah, like we still dealt with it as a matter of sex where that was appropriate, and dealt with it other places where that was appropriate. So I don't think calling it an STI is limiting in that way. And I don't think we just can't pretend that this is this is the reality that is happening right now. And it's difficult, but worth talking through the fact that, yes, a couple of infants have gotten it. Yes, there are gay people who are parents or who are caregivers and, who hold their children closely. So if you are in a position where you think that you might become infected with this virus and have the opportunity to get tested, then you should, if you are also in close contact with other people in those ways. But it's happened so little, and I know that we talk about exceptional cases with an exceptional amount of coverage, that it's happened so little means it's actually not happening that often. The primary mode that it's happening right now is through sex, and so I'm calling for we need to do more research in that area to see, like, would condom use help? It may or may not. It may just be that skin is near skin and it's still transmitting, but people should be researching right now, like, sort of what is the viral load that's coming into sperm cells to see if maybe condom usage should be taken up again. Because a lot of people, and this is an act of moral, ethical, and scientific responsibility, many gay men have gotten on a drug called PrEP, which prevents HIV transmission. And if you get some other STIs, they're very easy to deal with. But maybe this isn't that case. Maybe maybe condoms need to be used again. That is not, I will say this very clearly, like, I have no evidence to know that's true now, but that should be researched to see if that's the reason why it's so lodged in this population right now.
Hey YouTube, thanks for watching. Just a reminder that this is a podcast. You can catch an extra premium episode every Monday for $5 a month at patreon.com/badfaithpodcast. That's patreon.com/badfaithpodcast for $5 a month, an extra episode every week. Additionally, please do consider liking this video, subscribing to this channel. It helps us out. It helps independent media beat the algorithm. We appreciate you. And as always, keep the faith.